I had a very informative discussion with Dr. Willett at last year's symposium about the amount one should take. And I mentioned that I'm taking 10,000 units a week. And he said he has people on much more. And this morning he said 4,000 or 5,000, which I find that a lot of GPs don't even know about. And this is a two-part question. People say vitamin D as a catch-all phrase. Is there a difference between cholecalciferol, which is D3, and vitamin D that's in your multivitamin?
Okay. Walt, you're...
Right, that number, I think just to be clear, the 3,000 or 4,000, it does look, the reality is that as we're getting more experience with more doses, many people do require that much to get up to a level. Probably it's a good idea to check, have your physician check your level before going much beyond 1,000, although I may come back 2 years and say we know enough, we have enough experience now to say that that's perfectly safe. Everybody could be taking 3,000 or 4,000, but we're not quite there yet. The reality is many people will need that level to get up to the right blood level. And the vitamin D3 is the natural form of vitamin D, so I think that's the best one to take. The vitamin D2 is a synthetic form, and there's a lot of debate in the field as to whether the activity is similar. So I think it just makes sense here to stick with the natural vitamin D, the natural form, and D3 is that natural form.
All right. One last comment about D, and then I sort of want to move on. You know, there's a well, Mike, you say it, and then I'll say it.
No, you say it.
You know, I mean, the point is, what we're trying to do, if you really think about it, is kind of duplicate the natural state that we evolved from, all right? I do believe in evolution, all right? I will at least I can't use the word belief. The evidence is overwhelmingly in favor of evolution, all right? You know, I mean, I believe in God. I believe Mozart was a great composer, but I think there's overwhelming evidence in favor of evolution. And the fact is that, you know, you get D from sunlight. You also get bad things in terms of wrinkles and skin cancer or whatever, and so that's what we're talking about. We're talking about, you know, avoiding, you know, if we want to live beyond our reproductive years, which may not be our natural state, is to do this. And the same thing with intake of micronutrients. I mean, it's in food. And, you know, the folic acid comes from eating the right kinds of foods. And so you're trying to return to the natural state that we have altered dramatically over the last, actually probably only over the last century or so, is that when we're largely an agricultural society, we spent a lot of time out of doors and we ate a lot of things that grew in the earth. That's what it's all about, because you can hurt yourself with mega doses of things. And I believe that, you know, I'm trying to look from our Canadian colleague who actually, here. I guess, huh? Are you there? Where are you? Huh? Yeah, do you want to make a comment about the megadose vitamin D thing aspect? There you go. I couldn't see you. You were hiding. Thank you.
Hiding, yeah.
Introduce yourself.
So this is obviously a controversial area, and it's an evolving area. And you know, I think what we know about vitamin D, as Walt has said, a lot of it relates to bone health and general health. And the research in the area of cancer is in the more recent times, and mainly in the last 10 years. And I think that I am on the same page as Peter. I think we need to be cautious here. I think we need to have enough vitamin D that our vitamin D blood levels are in the healthy range. I think we're learning, as Walt is saying, that this is a changing target, that the amount an individual person needs to get his or her vitamin D levels in the proper range is actually quite variable. In Canada, where I'm from, our Canadian Cancer Society has recommended everyone take 1,000 a day. Now, that's probably safe, but my patients come in taking 10,000. They say, well, if 1,000 is enough, 10,000 is better. And I think you actually maybe can take too much of this vitamin. We know that you can take so much that you cause your calcium levels to go up and that you can become very ill. We don't know what high-ish levels do in terms of cancer. It hasn't been well enough studied yet. We all believe that there's a nice healthy range where we should all be, but there are some concerns that pushing beyond that range may not be best for your cancer health. So I think we just need to be very, very cautious. I think each person that is considering taking more than about 1,000 a day should probably consult with their physician, get their blood level checked, and dose appropriately. The dose may differ in the summer and the winter. But I think we really shouldn't think that if some is good, 10 times that amount is better. this is an evolving area.
Thank you. Now, the whole, introduce yourself, please. Everyone wants to know who you are and where you're from.
Sorry, I thought Larry had done that. I'm Pam Goodwin from the University of Toronto. I'm a medical oncologist, and my research focuses on host factors in the outcome of breast cancer, so in women who've already developed breast cancer.
Okay. Thank you. Now, there's an underlying theme here which I want to identify, because I think that as we meet in future years, God willing, we will that this theme will mature and be carried forward. D is good, D is bad, a certain kind of notion. We might have 15 years ago, when we talked about cancer, we talked about things of that kind of nature. Now, our level of understanding is so much greater. And although we don't have the answers, we know we have to look for the answers at a much deeper level of understanding of the genetics of cancer, of the abnormalities and the genes that cause cancer and how they relate to normal cells. And that's really where we all should be thinking, rather than the notion is, vitamin C, okay, take vitamin C, you live forever. Take vitamin E, you live forever. The complexity of the situation is very clear from what you've heard in terms of the clinical data, but it's also something that we have to address from the molecular point of view as well.